So, doctor, the first question is about your history. You know, your alma mater is Erasmus University in Rotterdam, Netherlands, and one of the top rare disease centers in the world. So please tell us, when did you decide to dedicate your attention to rare diseases?
Well, although I graduated from the Erasmus University, I did all my postgraduate medical training in the United Kingdom. And later on, I worked at the National Institute of Health in America doing research. And eventually, I focused on multiple myeloma. And in myeloma, interleukin 6 was important at that time. And in fact, at our center in 1994, the very first patient with Castleman's disease was treated with an anti-interleukin 6 monoclonal antibody. This was an antibody of mouse origin. It had a short half-life. It didn't go into full clinical development, but it did provide proof of principle that targeting interleukin 6 is an important option for the treatment of Castleman's disease. As a result, at the center where I'm currently, the University of Arkansas for Medical Sciences in Little Rock, we got a lot of referrals for patients with Castleman's disease. Initially, we utilized the anti-interleukin 6 receptor antibody, also called tocilizumab. And later on, we took part in all the clinical trials with siltuximab, using the anti-interleukin 6 monoclonal antibody. So we've had a long history here of at our center in dealing with Castleman's disease.
Okay, great. So, Dr. Van Rhee, you're ahead of one of the largest population of Castleman diseases patients in the world. Could you please tell us a brief history about the construction of this registry and the first insights revealed due to the access of this data?
Okay. Yeah, I think with the Castleman's Disease Collaborative Network, we have a registry in which we are accruing patient data. We have an access committee where we look at all the data and also the pathology. We retrieve the slides and then assign a likelihood that the diagnosis of Castleman's disease is correct, and we assign the subtype. Then we don't only look at clinical characteristics, but also at patient outcome with therapy. So essentially, this is a database with validated real-world data. Then the way we accrue patients into the registry, we have a patient directed arm where patients can contact us and volunteer their data. Then they give us their consent to retrieve all their medical data from their doctors, and that data gets entered into the registry. Alternatively, there are participating centers where the doctors and their staff get permission from the patients to enter patient data into the registry. So taken together, this patient-directed and physician-directed arms of the registry both serve to accrue patients in our database. And Castleman's disease is a very rare disease, so it's important to get as much data as we can about this disease. It is very difficult to do clinical trials in Castleman's disease because of the rarity of the disease, and to get what we call real-world data on patients is a very important addition to the body of clinical trial data that exists.
Doctor, we are talking about how many patients? Can you tell us? In your
well, we have well over we've accrued in the order of 100 to 200 patients into the database. And if you give me one moment, let me just look something up here. At the moment, we have in our database, and we just published a journal in the British Journal of Hematology on the disease course of Castleman's disease patients with a fatal outcome. So we have 140 patients in the registry with a confirmed diagnosis.
Okay, great. And doctor, if Brazilian patients is interested in participate of this registry, he can contact your institution?
They can contact either myself or Dr. David Vakenbaum, yes.
Okay, great. So let us move. Castleman disease describes a group of rare disorders with a wide range of symptoms. Could you tell us if we have good news for Castleman disease patients? I'm talking about not only the UCD, but the ME-CD type 2. Do we have good news for these patients?
Okay, well, there are a number of important developments. First of all, we developed international consensus diagnostic and treatment guidelines for unicentric disease, which can help to treating physicians. Similarly, for idiopathic multicentric Castleman disease, we also have diagnostic and treatment guidelines, which again will facilitate diagnosis and assignment of correct therapy. We have anti-interleukin-6 monoclonal antibody, siltuximab, which is the preferred first-line therapy for Castleman's disease, which has been proven to be effective in clinical trials. We have also now published research that we can identify patients who are most likely to respond to siltuximab. And there are novel therapies in development for patients who do not respond to siltuximab or respond inadequately. There's a drug called sirolimus. And we also have evidence that patients who do not respond to anti-interleukin-6 monoclonal antibodies may still have activation of the interleukin-6 pathway and perhaps can benefit from oral drugs that can be utilized to silence this pathway. So in other words, there are novel therapeutic targets and drugs in development which may help patients who do not benefit from siltuximab and other interleukin-6 directed therapies.
Oh, this is amazing. Thank you, doctor. So the last one is about this topic, the registry. Here in Brazil, we face a lot of challenges concerning Castleman disease data. And one great go ahead is the construction of a Brazilian registry about this disease. What are the key points, in your opinion, to construct a rare disease registry?
Probably if one considers Brazil, it's a very large country, and perhaps one could initially start with large academic centers where physicians and pathologists who see Castleman disease with some frequency, and they could potentially have some support to develop a Castleman's disease registry. That probably would take at least 1 or 2 dedicated persons to retrieve all the data. And we probably would be quite happy to collaborate with them to establish what are the critical data fields to capture and what database to use. Then once the academic centers are collaborating to establish a database, then perhaps at a later stage, it can be opened for patients, very much in analogy to the Accelerate database that we currently have in the US.
Hey, doctor, to finish, if you would like to leave a message for the Brazilian patients that used to follow this week dedicated to Castleman disease, it would be an honor.
Okay, I think that the first thing is that Castleman's disease can be treated very well, and the majority of patients with appropriate care have a good long-term outcome. I do think it's important to get a physician involved who sees patients with Castleman's disease with some regularity. In other words, an expert. You want to have a good clinical doctor involved, and also you want to have your lymph node material reviewed by an expert pathologist. Now, it is appreciated that it's not always feasible for everybody to receive care at faraway centers, but at least advice can be solicited, or alternatively, patients can make one or two trips to a doctor who's an expert in this disease, and then the therapeutic plan can be implemented locally. So I would think there is hope. Most patients do well and do get an expert involved in your care.